Hi, I'm Brooke Nix with Brooke Nix Medical Aesthetics. And today we have Bailey here, who we are going to do a complimentary consultation. Bailey has an 8-month-old little boy, and she's ready to get started again post-pregnancy and breastfeeding with injectables.
Okay, so I just turned 29, as you know, also have an 8-month-old baby, and I'm really ready to jump back into injectables and kind of work on some things I've never had to work on before. So I'm really noticing some heaviness here, around the jawline, and I would love a little bit of a lift in the brows with some Botox maybe, and a little bit of fine lines across the forehead. So I would love to get your recommendations for skincare, for injectables, and just anything that you would think would be a great fit for me.
Well, Bailey, the first thing that we're going to do is start kind of from the top down. One of the main things that we like to do, especially with your age at 29, is to use Botox. Botox works to treat muscles between your eyes, your forehead, and your crow's feet, most commonly. When we're treating with Botox, we're actually treating the muscle and kind of breaking the communication between the muscles. So when you think you're frowning or lifting your eyebrows, those muscles just don't engage, but it works in a way to where you look very natural. So when we treat these areas, we treat this area right here through the frown line, across your forehead and the crow's feet, but other areas that you've kind of mentioned that might be a good option for you are also your masseters. Since you have trouble with grinding at night and you already wear a mouth guard at night, you tend to get a lot of pain and tightness in this area. So we're able to use Botox into the masseter to help relax that and hopefully give you some relief. It also can thin the face as well too. So we can kind of take off a little bit of the volume that the masseter, as it continues to grow as you're flexing it, it will take off that volume and slim the face. Now I'm gonna have you look in the mirror at you. And so you kind of mentioned that there's some things that you see that are changing as you get older. And so things that we can help with, and I think that's really nice to start with, especially at your age, so that we can hopefully prevent the aging from beginning, is we can start actually right here in your temple. You have a little bit of volume loss in this area. So if we add a little bit of volume here, you'll actually get a lift. For everyone, even in the 20s, it's nice to put a little volume in the cheek because the cheek causes the nasolabial fold to develop more. So if we inject here, it's actually gonna lift up for you. And then we might still need a little bit in that piriform aperture. And where I think you're really gonna be excited is the jawline. And so we have a new product called Volux. It's kind of like Voluma for the upper face, but with Volux, it's a bigger, more robust product. So as we inject it along the jawline, we can actually treat this and give you more of an angle into the jawline. So I'm gonna have my assistant come in and kind of give you the breakdown of the different prices. This is something that you can take, you can look over at home, or if there's anything that you want to start with today, we're happy to do that for you. So Bailey, we're gonna start with Botox in your forehead. Will you lift your eyebrows up for me and relax? Bailey, I'm gonna treat your glabella now. And that's it for your forehead and glabella. And we're gonna hold pressure for a second. I'm gonna do the side of your crow's feet. And then Bailey, I want you to kind of grind down so I can feel your masseter. So it's just 3 little injections in this area too. And this side's all complete. These little mosquito bites that you have right here are gonna go down in about 10 minutes or so. And really with Allie holding pressure, I don't think you're gonna have any trouble with bruising. Okay, Bailey, now I'm gonna start with your temple. Do a little injection right here. It should feel a little bit like pressure. And we're treating her temple just to even out the volume in this area and give her a little bit of a brow lift. I'm gonna give Voluma to her cheek, where we can shift the light reflex from here up to the angle of her eye, which looks more youthful. Okay, and we've got one more injection on the side, Bailey. I'm gonna right here at the piriform aperture, which that one injection is going to actually help pull up your lip as well as treat your nasolabial fold. Okay, so that's all the Voluma on this side. So now that we've finished the Voluma on Bailey's upper face, we're going to use Volux, the new injectable by Allergan, for her jawline. Our goal is to give her more volume in the gonial notch and give her more of a snatched jawline. Okay, it's the only injection you need on that side. So now we've done Voluma in Bailey's temple, cheek, and in Volux in her jawline. Now we're gonna treat the other side. So we have Voluma here again to lift the brow, in the cheek for lift, and again in the piriform aperture, which pretty much this one injection treats the entire nasolabial fold on most patients. Now for Bailey's last injection, we're gonna finish out the Volux on her right side. So we have finished all of Bailey's injections now. Volux will last somewhere around a year in her jawline, and then the Voluma can last up to 2 years, especially since she started using it more for prevention. So Voluma can take up to 2 weeks to integrate into your tissue, and Volux can take about 4 weeks, which means you may feel a little bit of the volume in that area during the time where it's integrating into the tissue. However, you won't see it. It looks natural from the beginning. To schedule a complimentary consultation for one of the procedures that we just performed, please contact us at www.brookenix.com or call us at 865-333-0186.